Good evening, everyone. I'm Dr. Shailesh Gupta, robotic laparoscopic surgeon from Max Patpardhan in Vaishali. So today I'm going to continue my colon and rectum series, which is a part of Mastering Variance System page by page. Today I'm going to cover a very important topic, a very common pathology which we see in our daily practice, and that is diverticular disease, right? So this will be the flow of lecture. It is same as the other lecture. There will be few MCQs. Then we're going to discuss about the theory, and in the last, I'm going to discuss about their answers. So this is the content of the today's lecture. I'm going to cover diverticular disease. I'm going to cover colon diverticula A to Z word by word. We are not missing anything. We are totally covering everything from the suggestion. I'm going to discuss about definition. It is basic introduction. हम लोग डिस्कस करेंगे पैथोफिजियोलॉजी के बारे में. हम डिस्कस करेंगे how we evaluate the disease. We will discuss about the management, and in the last we will discuss some special situations. So first introduction. So these are the few questions. I would request the students to please write their answer in chat box. Question number 1. Diverticular disease is most commonly associated with which part of the colon? Which part of colon सबसे ज्यादा commonly हमें diverticular दिखते हैं? Ascending colon, sigmoid, transverse और descending colon. काफी basic question है, right? Question number 2. What percentage of individual older than 80 years may be affected by diverticular disease? ये basically western world के बारे में बात कर रहे हैं. ये जो data जो है, that is basically we want a US data here कि 80 years के बाद कितना percentage of patient के अंदर हमें diverticular disease दिखाई देगा. 10 to 20, 30 to 50, 60 to 80 or 90 to 100. So we start with very basic. We start with definition. So basically, diverticular disease of colon is a range of sign and symptom which is related to the presence of diverticula in the colon wall, and it can lead to infection, perforation, bleeding, fistula, and occasionally obstruction due to chronic inflammation. So this was first described in mid-19th century. This is quite an important slide. Its incidence and prevalence. As the age grows old, patients have a higher chance of developing the diverticula, and it is more common in the US than the other Western countries. So US में most commonly पाया जाता है. उसका main reason है कि US people they consume less fiber, right? And it is very important stat कि 60 years के ऊपर 30% of individual will be having the colon diverticula, and over 80 years it is more than 60 to 80%. This is US data, right? You can see this कितनी common problem है US के अंदर, and it is obviously other developing countries के अंदर भी common है. So now this is very important point कि only 10 to 20% of people with diverticula develop symptom. So इसकी prevalence तो बहुत ज़्यादा है, but symptomatic diverticula का जो हमारा ratio है वो less है. So 10 to 20% of people with diverticula will develop symptoms. 80%, 90% नहीं होंगे. And it is seen that colon diverticula alone has 3 lakh hospitalization annually in the US, and it lead to 1.5 million OPD visit, like 15 lakh, 15 lakh OPD visit annually होती है, and annual cost of this total expenditure is more than 2 billion. So US का population है 25 crore. So despite of that, इतना high उसका इस disease का burden है. So diverticular disease is most commonly, ये point discuss नहीं करा, but मैं आगे discuss करूंगा. Most commonly sigmoid colon के अंदर होता है, right? And what percentage of the individual older than 80% will be affected by diverticular disease? Answer is 60 to 80% of people more than 80 years of age will going to have basically diverticular disease. So Dr. Alpana, descending colon से भी ज्यादा most common sigmoid colon के अंदर होता है. So you just remember sigmoid colon, right? So next is pathophysiology. So Dr. Alpana, can you tell me, or you can write in a chat box, up to you. So how a low fiber diet can cause the diverticula? Can you tell me the mechanism? how a low fiber diet can cause this uh, diverticular. What is the mechanism? What is the physics in this? You can come on the mic or you can pass also. Just no, not a problem.
Good evening, sir.
Good evening. Good evening.
Sir, actually, I don't have an idea about it.
No, no problem. No problem. So that is good thing. Now we know what we need to look for in the text, right? So you will go get your answers. Knowing the answer is not a bad thing. It is a good thing. We know what we need to now look for. So diverticula are most commonly formed due to low intraluminal pressure, disorder motility, high fiber diet, abnormal anatomy, right? इसमें से कौन सा कारण है जिससे डायवर्टिकुलर बनता है? So which tinea coli are diverticular formed? Basically there are 3 tinea coli, right? उसमें से किस tinea coli के अंदर diverticular बनता है? Question number 3, which of the following is a characteristic finding in affected segment of the colon in diverticular disease? Thin muscle layers, hypertrophy of muscle layers, normal luminal diameter, decrease interluminal pressure, right? So the question में पूछ रहा था उससे आप सारा आंसर कर पाओगे अगर if you know that answer. Question number 4, what effect does a low fiber diet have on colonic motility and pressure? It lead to decreased colonic motility and decreased colonic pressure. It lead to increased colonic motility and decreased colonic pressure. It lead to increased colonic motility and increased pressure. And it lead to decreased motility and increased pressure. So now I'm going to discuss what is written in the suggestion. So basically, diverticula is abnormal outpouching in the colon wall. What are the causes? Our causes are high colon intraluminal pressure, number 1, disorder colonic motility, alteration in the colonic structure, and the low fiber diet. So these are the reasons which are given in the suggestion, right? So basic जो है basic यही है, high colon interluminal pressure. So disorder colonic motility, low fiber diet, alteration in colonic structures are ultimately leading to high colon interluminal pressure, which is leading to formation of the diverticula. So बहुत important है ये नीट का MCQ है. So anti-mesenteric tinea coli basically is the site where यहाँ पे diverticula होता है. So just remember that in a colon there are 3 tinea coli. One is mesenteric, 2 is anti-mesenteric. ठीक है? तो ये anti-mesenteric tinea coli में commonly found out होता है, number 1. Number 2, why tinea coli is a location? Because tinea coli के अंदर ना vasa recta penetrate करते हैं muscle layer के अंदर to supply the blood. So ये area जो होते हैं, these are the site of the potential weakness. तो इसी area of weakness के अंदर से हमारी mucosa submucosa out होती है. So that is why tinea coli is a site of diverticular formation, and उसमें से भी anti-mesenteric tinea coli is the site. So there could be a false diverticulum and there could be a true diverticulum. False diverticulum के अंदर सारी layers involved नहीं होंगी और हमारे कोलोन के अंदर mucosa submucosa protrude करेगी through the muscle layer, right? True के अंदर there will be all layer involved. So basically जिस सेगमेंट के अंदर हमारा होता है डायवर्टिकुला, उसके अंदर क्या चीज मिलती है हमें? सो सिग्मोइड और डिसेंडिंग कोलोन के अंदर सबसे ज्यादा कॉमनली होता है और इन दोनों के अंदर से भी सिग्मोइड में ज्यादा होता है टोटल अपना, ठीक है? सो जहां पे भी जिस सेगमेंट के अंदर भी हमें मिलेगा उसके अंदर हमें आसपास की सराउंडिंग मसल में हाइपरट्रॉफी मिलेगी और ल्यूमिनल डायमीटर हमारा नैरो मिलेगा, ठीक है? दिस इज द थिंग that we're going to found out in the affected area, and right, and because of this there will be herniation of the diverticula through the muscle cord. So basic pathology ये है कि प्रेशर ज्यादा होता है जिसकी वजह से ये आउटपाउचिंग होती है और प्रेशर ज्यादा होने की वजह से हमारा ये डायवर्टिकुला बनता है, राइट? सो व्हाट नाउ इसमें इंपॉर्टेंट है रोल ऑफ डाइटरी फाइबर. सो डाइटरी फाइबर हमारा कैसे करता है? सो डाइटरी फाइबर होगा तो हमारा, नहीं होगा तो हमारा स्टूल बल्क विल बी लेस. सो एज द स्टूल बल्क इज लेस, कोलोन नीड मोर प्रेशर टू प्रोपेल द फीसेस फॉरवर्ड बिकॉज छोटा सा फीसेस है. अगर पेशेंट अगर हाई फाइबर डाइट ले रहा है तो फीसिस का बल्क काफी ज्यादा होगा, तो फीसिस अपने प्रेशर से प्रोपेल आउट कर जाएगा। बट जब हम फाइबर डाइट कम ले रहे हैं, व्हेन वी आर टेकिंग अ लो फाइबर डाइट, इट विल लीड टू लो बल्क ऑफ स्टूल। So because of the low bulk of stool, colon need to put more pressure to propel the feces forward. इस more pressure की वजह से हमारा diverticulum बनता है। So decreased colonic lumen content lead to increased colonic pressure to propel feces forward, and this increased colonic pressure lead to formation of diverticulum. Right? Now I hope it is clear. It was beautifully described in the semester, this line. So diverticula are most commonly formed due to disordered motility, right? Which Schindler coli or diverticula are formed of? Answer is antimesenteric. So you are right. Antimesenteric is the answer. Rotalpna. And just hold on. Question number 3. Which of the following is a characteristic finding in the effective segment of the colon in diverticular disease? Answer is D. Hypertrophy of muscle layer. As I told you earlier, colonic pressure बढ़ेगा तो हमारी मसल हाइपरट्रॉफी कर जाएंगे, राइट? डायमीटर विल बी नैरोअर एंड देयर विल बी इंक्रीज इंटरल्यूमिनल प्रेशर. क्वेश्चन नंबर 4. What effect does a low fiber diet have on colonic motility and pressure? Obviously because of the lower bulk, उनका motility कम हो जाएगा, तो there will be decreased motility. Pressure will be more because colon की मसल ज्यादा पुश करेंगी, ज्यादा कॉन्ट्रैक्ट करेंगी to propel the feces forward. So this will lead to increased pressure. So answer is choice number D. Decreased motility and increased pressure. So now is